Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and where we do encourage you to call in to join in. Today, well, yes, folks, it is a Friday. It will be a Get 'em Up, Out of Town version of the show. We will invite you to come on in anytime you'd like to share with us your concerns. The number to do that is 412-825-6262. I'm told we may have a little issue with phones. Bear with us if that is the case. It is being rectified, but nonetheless, we'll attempt to conduct our normal Friday business around here. But in keeping with a new guest to come with us on Monday, I'm going to set the stage for some new activity here, and well, you'll see what I mean by the time the end of the show comes around, because we have another thing to take on, and I will set the stage for it. So between you and I, we'll pull this off today. Anything on your mind is okay with me, and I will be waiting for that knock on the door. Hopefully, I'll hear the knock. Now, with respect to up and coming, yes, on Monday, a real interesting gentleman. His accent alone. He's a Ruski, folks. He's a Soviet Ruski. He's a very educated, scientifically minded individual. We're going to be swinging a discussion to the issue of fiber. We're going to be talking about his book entitled The Fiber Menace. His name is Konstantin Monastersky. I think I'm saying that right. And I feel he's so important with a very strong message to bring that we're going to set the stage today for his arrival on both Monday and Wednesday shows, talking about his book Fiber Menace, which is the truth about the leading role of fiber in, here they come, diet failure, constipation, hemorrhoids, IBS, if you don't know what that means, that's irritable bowel syndrome, UC, and if you don't know what that means, that's ulcerative colitis, Crohn's, colon cancer, all have a role to play, or within the realm of fiber and the potential hazards of it. It's our next quest, folks. And Konstantin Monastersky will be taking charge of our little school here on Monday and Wednesday. I hope you enjoy him. I think you will, and we will set the stage for his arrival for our show today. On Friday of next week, David Brownstein returns. We're going to be able to conclude our discussion, I hope, one of his many books entitled Salting Your Way to Health. If you are not a salt aficionado, and by the way, there's quite a salt-scared generation that has all come up in the last 20 to 30 years. You may very well be a part of it. I know when I talk to patients who I meet for the first time and I bring up the issue of the salt, it's quite common for me to hear, oh my God, I would never touch this stuff. Well, you better think about touching it, and even some special forms better be sought after to be able to touch. We're going to get to that issue on next Friday with David Brownstein on his return. Also, speaking of next Friday, and in keeping with the discussion we had with you-know-who on this past Wednesday show, Dr. Vavavoom herself, Susan Smith-Jones, she got that webinar coming up, folks. I think it's a great opportunity for you to come to meet and to know her, actually see her in the flesh, because it should be a over-the-internet broadcasted webinar that you'll be able to, she says she's going to take the stage. It's all her show for about 1 full hour. If you want to be a part of it, got to go to her website at susansmithjones.com, click on the icon marking newsletter, September newsletter, and then when that page comes up, you'll see about the third paragraph down a discussion about the webinar. Click on that. A little window pops up asking you your email address. And one other thing, I forget what else I filled in. Well, the email address was one, and there's one other item, and then you just submit that, and voila, you are invited. I am waiting to see what I was told that should next happen, which is I'll be informed by email of the actual time, the starting time. However, you know what that is, 2 p.m. our time next Friday. So I bring that to your attention. Maybe you want to participate in that. Brian Peskin Week is coming up the week of the 19th. So on 19, 21, and 23 September, we're going to be delving quite profoundly into this issue of the controversial subject of fish oils and essential fatty acids and omega-6s and omega-3s and how you should get them. And it will be nothing more than further fodder for you to be able to appreciate the point we're trying to bring home to you to allow you to have constructive, healthy activities. You who are so informed about how to maintain your health might be putting yourself in jeopardy if you are one of the fish oil fanatics that have been developed over the many years by people like myself and other well-intended individuals, but without the scientific information, we have been misinforming you. And of course, if you've been listening to this show, I am attempting to correct the wrong, correct the right, and get you back on track to be able to make those healthy decisions. Brian Peskin, you will, well, I don't know if you'll like him, okay? He's got this personality that just, it'll rub you the wrong way, but the science that he brings to you will be able to back it up with science. He's an MIT graduate in engineering, has no real medical background per se, but then pursued the medical realm by virtue of his very intense scientific background. He went in to find in the literature that which we were lacking when we were providing you with those recommendations about the fish oil. So I'll say again, fish oil is hazardous to your health, and you need to make a change. What to? Well, you of course know about the product line by Body Bio. At this point, you can't keep it on the shelves around here. It keeps flying off of them. But there is a oil, the parent oils, new terminology, parent oils of omega-6s, omega-3s, not the highly concentrated EPA and DHA coming from fish oil. This is an unnatural source. It is too highly concentrated. Your body can't handle it, and you need to provide the body with the building blocks so that it will make whatever amount of DHA and EPA you need from the parent oils. The parent oils are, in the omega-6 category, linoleic acid, and the representatives are things like sunflower oil, primrose oil. And in the omega-3 category, alpha-linolenic acid, and the best representative of that, of course, is flax oil, in a mixture in a ratio of 4:1 of omega-6s to omega-3s. That's omega-6s to omega-3s. I hear a knock on the door. Come on in the store. Welcome aboard. What is on your mind?
Good morning, Doctor.
Hi.
I've just been diagnosed with a floater in the left eye. Now, the doctor...
You diagnosed it?
I'm sorry?
You diagnosed it?
No, I went to an ophthalmologist yesterday.
And he said you had a floater.
Well, yeah, because what I was experiencing.
Right. Yeah.
Something like I assumed it was either, I thought it was probably on the inside of the lens of my eye. He said, well, basically it's not at the lens of the eye at all. It's kind of in the jelly-like substance that's kind of in your retina. Is that right?
The aqueous and vitreous humor
That's it.
are the liquid components, gel-like components of the various chambers of the eye, perfectly clear substance. And these floaters, as I was going to say, that would have been an unusual diagnosis made by a doctor. No, you went with a symptom of a floater, and he was trying to explain to you what it was. So what's the question today, sir?
Okay, well, his main concern with these were, they could possibly make a tear in your retina. I don't know if you've ever heard of that or not.
Not make a tear, but if there were to be a tear in the retina, one of the manifestations of having such a pathology is that you could have not just a floater, frequent floaters, and that's why he had to take a look in the back of the eye. You do not have any retinal damage, is that correct?
That's correct, no tear. But now, see, what I was told by someone else, in a naturopathic sense, this physician, doctor, if you will, didn't go for. He said he didn't like these drops that dilate your pupils because, and then again, I don't know if he saw research on this or this is his take, but he said there could be the possibility of that can detach your retina. I don't know if you ever heard of that or not, Doc.
Oh, geez. I absolutely have never heard of the eye drops that are used to dilate the pupil. It is pilocarpine. It is a drug, and it stuns the nerves that control the musculature of the eye that controls the accommodation. When you dilate the eye, you get these huge pupils that you're looking through, but it's short-lived, and I'm unaware, quite honestly, of any.
Never heard of that.
Yeah, of any long. Now, did you go to an ophthalmologist or an optometrist?
No, not an optometrist. This was yes, in the Swickley Eye Group, doctor. He was a surgeon.
He was an MD ophthalmologist.
Absolutely.
Eye surgeon, and it's interesting because you say as a highly specialized and trained individual, he has a negative viewpoint on the use of dilating drugs. He doesn't use them ever?
No. He did not, but actually a well-known colleague in the area of chiropractic, Dr. James Weiner, I used to work for him at one point in time, and I know I heard on his show once, he said he does not get those drops. He says they still can look in your eye, but this doctor, when I told him about that, and I wasn't warmed to the key of these drops, obviously that didn't go down too well, and pretty much I don't believe he told me I can't do a proper diagnosis if we don't do that. Now, I said, well, that's fine. Now, I understand there are something that you can take, a preparation, just like if you're going for x-rays, to kind of buffer the effects. If they're, let's face it, drugs are drugs are drugs, and
right.
always some kind of detrimental effect. Now, there's one more real important facet of this, to this situation of mine, and I wasn't too happy hearing that. But as far as these floaters go, is there anything that you know of that can be done for it? He said basically there is not.
Well, let's just take these two issues in kind. First, the use of pilocarpine and other substances like it so that you can get dilatation of the eye pupil, so that you can get a correct evaluation of all the structures back there. Now, it is true that you can see, as you can well imagine, if the door is only partially opened, you can only see small amounts on the other side of that door.
Right.
If you open the doggone door, you can take a look in any room and check it out. Well, come on. A fellow who's trained in being able to assess these retinal structures and all the structures in the back of the eye needs a chance to not peer through a crack in the door. Open the door. If you want to have a correct evaluation of your anatomical and physiological components of your eye, especially when you're complaining of having floaters, you can't hold one arm behind the guy's back. I understand if you have any drug can cause a problem. Let's get that straight, okay? But now I can appreciate better. It was not the ophthalmologist who had concern about the drug. He wanted to use it, but you have preconceived ideas about the harm that might come to you from the use of the drug.
Over a period of time, doctor, right.
Yeah, and let's just say, I get maybe an evaluation of my eyes once a year, okay? Sometimes once every other year. At that interval, I'm not expecting any problems, and I'm a guy who avoids drugs at all costs. But there's a risk versus benefit. If you want to be appropriately evaluated and diagnosed, don't tie the clinician's hand behind his back so that he can't use all of his skill in your best behalf. He will evaluate you as you requested him. He won't use the drops if you don't want them. He's not going to wrestle you down and put the drops in your eye. but you're the guy who's gone to him for his expertise. Be kind enough to let the person, in my opinion, use what he needs to make that assessment.
Right, doctor. Well, I told him I'll be prepared for these drops next time. But this is a real important thing, and I do have to ask for this. Have you ever heard of this condition? Now, he's telling me that this is going to be me when I get into my 70s. I'm 55 now. This is a little bit putting some gloom and doom for me. It's called, and if I'm saying this right, Fuchs Fuchs dystrophia.
Okay, well, tell you what, I'm now writing it down. The next time, I don't know of this disorder, Fuchs dystrophia. I don't know what that is.
It's a cornea condition, doctor, degenerative.
All right, well, I certainly am aware of a lot of corneal issues. I've got my own to be concerned with. I'm not familiar with that particular problem, but I guarantee you this. We have Dr. Edward Conrad, an ophthalmologist who comes on our show quite frequently.
Right.
The next time he's here, we're going to ask him about it. We will get the appropriate answer from an ophthalmologist, one that I really can't provide you myself today. The final thing that you wanted to ask about were the floaters themselves. I can tell you, yeah, that's come up many times when Dr. Edward Conrad has been on the show.
Mm-hmm.
And when I've asked him the question, he says that the best theory of his own is that heavy metal burdens can have these floaters be a manifestation. Heavy metal burdens can, floaters can be a manifestation, better said now. Floaters can be a manifestation of heavy metal burdens. He always has patients do heavy metal challenges and clears the metals, and the floaters go away. Now, that's coming from an ophthalmologist and one that actually is alternatively minded. So I take what he says at face value. I say, he ought to know. And I pass it on to you as my advice to you, because that doctor that you saw the other day, the ophthalmologist, he can't see that floater. He doesn't know what you're talking about.
Oh, he saw it, doctor.
Oh, he saw the floater. He saw a floater.
Oh, he said he saw it when he didn't believe me. He put me through all the 9 yards. What he can get into that eye, what he knows it to do, he did it. Believe me, he checked it out very thoroughly.
Okay, I didn't.
He said, yes, I do see that floater. Now, one little thing, and I'm not going to get too, I don't want to get too personal with Dr. Conrad here. I do understand that he was pretty much renowned in what he does. I got to tell you, when I brought his name up, and I did, to this ophthalmologist, actually, he didn't have too much favorment feedback.
Oh, he does not understand. Sure.
On his,
hey, because he doesn't understand what...
Let me just tell you real quick. He heard that he was sued many times for practicing the naturopathy thing.
Oh, let's just get this one thing straight. He has never been sued, ever, for the practice of medicine in the way that he practices it. That's absolutely correct. And as for the other comment, bring my name up into a group of physicians and start writing, man, because you're going to get an earful about opinions about me with respect to the kind of medicine that I may practice. So I never worry about a conventional doctor casting opinions on my own particular practice of medicine, and certainly when I hear it of others who have this art and this other expertise, I could just fully expect. They know Dr. Conrad because he's published, because he has books out there, because he keeps coming to Pittsburgh. He's a little bit of pain in there behind. But,
I'm sure.
So thank you for the question. I hope I've been able to help you somewhat in your dilemma. Keep staying tuned. Look forward to Dr. Conrad's return, and fuchsia dysplasia is on my list, okay?
Well, I believe it's dystrophia.
Oh, dystrophia. Okay.
D-Y-S-T-R-O-P-H-Y. He wrote it down. But I left this doctor with this. I said, believe me, I'm going to do my homework. And he said, I bet you will. But like I said, he's a conventional doctor. He's a surgeon. That's what he does.
That's right.
And, but I told him, I said, I will give you credit, sir. I see on your counter out there with your fine ladies at the reception desk, you did have some supplements. It's got some lutein in it and all that. I said, that's a positive facet, and I did give him some credit for that.
Hey, they're all going to have to come around at some point. He just seems like he's ahead of his game. So, hey, salute him. The guy's intelligent. He's an absolute,
absolutely.
I mean, he's an ophthalmologist as he was trained. He just can't appreciate much of the discussion of an Edward Condra and probably of myself. But hey, we don't hold it against him. He has a level of expertise, and when you need to have that kind of a scrutinization of your medical issues with respect to eyesight, just start there. He's the guy, okay?
Well, I actually, I came home from my shopping, and I had this for about 4 or 5 days now. And when I called the eye group up, the gal was pretty persistent. She said, you know what, I would drop what you're doing and come here immediately, and which I did. And I thought it was a pertinent need to do that to see what's going on. There was no tear, no tumor, no nothing like that. But with this dystrophy, or how you pronounce that, he's painting a picture, doctor, that down the road in my 70s somewhere, I'm going to have to buy myself a guide dog or have a cornea transplant.
Well,
that's insane.
All right. Well, we're going to need some second opinions on that one. Let's just say for now, they called you in because they felt that the floater could represent the possibility of a tear. You have no tear. You just have a floater, and let's work on the heavy metal principle. Remember, keep an eye out for Dr. Condra's return on the radio, and give us a call then. Keep listening, okay? All right? Oh, he's already gone. All right, folks. Eye disease. Huh. All right, let's do this. Take a short break. When we come back, we're going to start to set the stage for a new issue. Konstantin Monastersky is going to be the instructor on this issue, but we're going to set that stage on the return about fiber. Let's see how it goes. Be back in a moment.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Honey, just got the word. The company's new health plan has a $5,000 deductible. We have to make sure nobody gets sick this year. Remember what those doctor's visits cost for last year's colds and flu? Well, sorry, I've got to go. Love you.
We can do this. We can cut the fast food lunches. Soda, that's a lot of sugar. We could all take that evening walk. And hey, I heard a program about fruit of the spirit. What did they say? 1 ounce, the equivalent of 5 servings of fruits with herbs and minerals. We could add some to our breakfast protein shake. Fruit of the Spirit is a unique whole fruit puree. Fruit of the Spirit contains fresh fruits native to the Holy Land and alkalizing minerals from the Dead Sea. With no added sugars, Fruit of the Spirit is a unique product from 5 years of work from science-based nutritional experts. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, convenient, affordable, and delicious. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Hey, good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. We're here today on a Friday version of the show. It is a get 'em up out of town version of the show. You can knock on this door at any time. We'll let you on in the store. Question or comment, anything on your mind is okay with me. The number to do it, 412-825-6262. That's 412-825-6262. We're going to be setting the stage here in a moment for our guest arrival on Monday, Konstantin Monastersky. We're going to be talking about gastrointestinal issues. It's been a long time since we have, and in particular, the issue of fiber. I'm going to set that stage here in a moment, but we do have another knock on the door. Why don't you come on in the store? Hello, and what's on your mind?
Hi, Dr. Courtney.
Hello.
Where do I have myself in a ball game?
You're in the ball game, you say?
Yeah.
In what way?
I am laying in a hospital bed.
Yeah.
And I talked to you about 3 weeks ago, and I was having some intestinal issues, bleeding internally.
Oh, boy.
Had it checked out, and to my surprise, it wasn't a stomach ulcer. It was a carcinoma.
Goodness gracious. You've had surgery since then, I'm taking it?
I'm in bed now, yeah.
Post-surgery, you had a partial colectomy, maybe? Did you right? Is that right?
Yeah, they took about 1.5 foot out.
Hopefully you did not need or require a colostomy, or do you have a partial one for now?
No, I don't have a colostomy.
That's wonderful. That's wonderful. You absolutely, well, I'm so sorry to hear that you were afflicted with a cancerous lesion. Happy to hear that, at least as far as you can see, for you to have this surgery, actually, I'm going to give you some good news, all right? I'm sure you have been laden with some bad stuff, but it was impinged upon your doctors to go and search to see if there was any metastatic spread of that disease by the various x-ray studies that you had. Can you recall how many studies you had before your surgery? Quite a few, did you not?
Actually, only about one. I went in to the regular, probe, and that's when they found it. So after the operation, or right before the operation, I'm trying to think everything's quite a blur because
Sure.
1 week so far. So I went in and had it, and I was admitted, and they had 1 day, and they checked on some stuff. And they wanted to see whether it went through the intestine wall. And apparently I had 1 or 2. One was benign, the other one I think tested positive. And but he says with what he's doing and the amount that he's taking out, he's pretty sure he got everything.
All right. So let's just say for the moment that that's accurate, okay? That that's 100% accurate. That whatever lesion was approachable was removed. That allows a surgeon to make the statement, "I got it all." I think we got it all. I think that's probably the fair statement. Okay. Here's where I think I want you to start putting your mindset now as you're recuperating from this, and there's certainly no rush to do it, but I'm concerned, as well as your doctor should be concerned, about where the metastatic spread has gone to, because I'm guessing this lesion was a lot larger than a millimeter. Do you happen to know the size of the lesion?
Well, they have the pictures of it right outside.
Well, for you to have a picture, it's multiple.
It almost encircled my whole inside of my intestine, because that's what was giving me so cramped, because I was getting constipated from it.
Here's the only point to keep in mind, that this was a lesion of considerable size, certainly measured in centimeters and probably multiple centimeters. And we would know that any lesion that has been able to attain that level of magnitude of growth is going to be associated with metastatic spread of disease. At some point, you're going to be recommended to pursue the remaining 2 issues on the plate in the conventional realm, and that will be either chemotherapy, radiotherapy, or both. And you'll be having to make some decisions in the near future about what you'd like to do. You should probably, at your leisure, once you get out of the hospital and recuperate from the surgery, come on in so we can talk about making proper choices for you, allowing you to determine what the course of activity in the future is going to be. As to whether or not you do chemotherapy, that's completely up to you, but it's going to be offered. As to whether or not you do the radiotherapy, that's up to you, but it's going to be offered. You need to know what other options are that aren't going to be offered to you by the conventional world, and I hope to be able to help you in that regard. Kindly utilize me as a fountain of information for you to be able to make some pretty important decisions in the future. But you get better now. That surgery component is over with. There won't be any more surgeries. That's the one and only. But there will be offerings to, at least from their perspective, bring you to a better quality of life. I think that's up for grabs in terms of what they're going to recommend, but we need to talk about it. Fair enough? Get better. Get out. Come on in and see me so we can discuss it. Fair enough?
All right, sounds good.
Okay, you get better now.
All right. Well, I'm already one of your patients, so
I'll
be up there to see you.
All right. We're looking forward to it.
All right.
Okay. Yeah, folks, you understand. So this one's good. Okay, I'll take other phone calls today. 412-825-6262. Anything on your mind is okay with me. Now, setting the stage. I was sitting back the other day and I was thinking, and it's pretty difficult for me, but I was thinking over these many years now, so many different myths, fallacies, absolute incorrect information had to be set straight by me, at least in order to be able to look you all in the eye with a straight eye. As these myths sort of popped up, they've evolved over time. I was trying to come up with a list of some things. And so as I did that, I was looking at these multitude of myths that we've taken on over these many years. Now, this may be a very incomplete list. You might have a better list. But as I thought it out, I thought that one of the first things we ever got to tackle around here was one, and we still tackle it today, the cholesterol myth is just that. It is a myth that cholesterol is somehow harmful for you, and except in the most remote and isolated cases, it is not. You need every bit of it, and it was nice, and the recurring theme of talking about cholesterol and the fact that it is not harmful is something I've enjoyed doing over the years. Along with that, of course, you take on an additional myth, which truly is a myth, and that is that statin drugs are helpful to you, because except in the fewest and most isolated cases, it's not only not helpful to you, it's quite unhealthy for you in a whole bunch of ways. So that was one of the myths that sort of popped into my mind. Another one, and it is also a recurrent theme around here, is the medical management myth that when you go to your doctor and you get evaluated for your yearly checkup, the lab work that gets done on you, I believe, has always been woefully incomplete. That gee whiz, a CBC and a chem metabolic panel in a person out walking the streets is almost all the parameters are normal. Of course, they tack on the one additional laboratory component, which is the component that describes your lipid profile, and that's your cholesterol, your triglycerides, your HDL and LDL. One lab, which is a specialty lab. We now know, because our list keeps growing, that there's actually a total of 10. I'm not going to get into those 10 labs. You know of them. You have heard me speak of them multiple times. And, of course, the newest addition to the list that I enjoyed bringing to you literally only 2 months ago was the 10th test, the newest one, called TMAO, standing for trimethylamine oxide, which I won't get into now. That's not the idea behind it. But the list is now 10, and it's climbing. And so if you need an assessment of what your status is with respect to risk factors, especially relating to cardiovascular disease, you've got a list of 10, and I've been very happy to be able to bring you that list over a lot of years. We're one of the first to bring you, and continue to do so, a procedure known as ECP. You've heard me speak of it frequently. I'll continue to speak of it. We have 2 of the devices here in my office, and many of my patients avail themselves of that miraculous procedure, able to restore a level of microvasculature in all the organs, not just the heart, but all the organs, to help tremendously in alleviating symptoms and improving one's status well into the future. Now, we may have been one of the first with ECP, but we are the first with bringing you another combination of 3 letters, MCG, and we've been very proud to be able to do that. That's been only since February this year. By the way, yesterday came by and we didn't have our second MCG testing. I will tell you that I probably will have an announcement by Monday as to when the device is going to be here. We've had some technical issues to come up, but MCG testing, which we initiated here in February and which is now going to be in the office all the time, it's been very, I've been very pleased to be able to be the first to bring you MCG testing, a conventional tool held in the hands of very few conventional doctors. We're one of those few places where you can get it done. More recently, too, certainly one of the things we've tended to just completely blow a hole in has been this issue of fish oils. Yes, I did make the statement that fish oil is hazardous to your health. It is, and I won't go into it now. We'll be going into plenty of that when Professor Brian Peskin becomes our guest on the 19th, 21, and 23 shows of September. By the time we get done with that week, all the facts, as supported by a guy who went and found the facts, and will be reporting them to you from the literature with which he found them, and these are going to be prestigious journals, so if you are still wrestling with the fish oil issue, make sure you stay tuned for that month, or that week of 19, 21, and 23. Now, as I thought, and sat back and was thinking about the various myths we've been able to crush over these years, it just was only, well, it's in my blood, it's in my nature to think there's got to be another issue to bring to you. And that's the issue we're going to be embarking upon with Constantine Monastersky on Monday and Wednesday. And that's the issue of fiber. It looks to me, as much as I've been able to read right now, and I've been reading incessantly on it, that I'm ready to make another statement. And so you may want to follow hearing this statement by saying, there he goes again. But nonetheless, it's my job to find the fallacies and the myths and to bring them to you and bring the science behind why they may be correct. How about this one for the newest entry in my list of myths to debunk that I've brought to you over the years? Here it comes. Eating fiber can be hazardous to your health. Never really knew how hazardous. This is what we're going to be exploring. Another one of the myths needs to be blown with respect to a common, I believe, an all too common misunderstanding and misinterpretation of the role that fiber should be playing in your diet. Now, let me start by saying I use the word can be hazardous to your health. Unlike the fish oils, where it's just, I've been saying flatly, fish oil is hazardous to your health. I think that's an accurate statement. I back it up with the science. I'm not going to budge at all from, although maybe in the initial days of taking fish oil, no, you can take that for some small amount of time without any problem. But ultimately, there will be a problem with taking fish oils, and it will be hazardous to your health. Now, when it comes to this new mantra of the fiber, we say fiber can be hazardous to your health because I'm looking in the book, and we're going to be utilizing this book written by Constantine Monastersky called Fiber Menace. It clearly states, if you consume minor quantities of fiber from natural, unprocessed food, there isn't anything wrong with it. Because, and he gives you about 3 different reasons of because A, it's a small amount of natural fiber, which is mostly soluble and will not obstruct your intestines or cause diarrhea. Small amount. Get into this issue of small amount. B, most of it, meaning most of that small amount of fiber, will get fermented in the large intestines. And C, the remainder will not bulk up the volume of stool high enough to cause any damage from roughage. You didn't think there was any damage maybe that could be possible from roughage. Oh boy, we're going to blow that one. That's another myth, and we'll blow it sky high. But this small quantity of fiber, the one that won't harm you, is not really what most Americans do or are urged to do by their doctors. Now, how would you know that you're going to be in the category of that you should be concerned or not? How about things like this? Can you ever remember using this statement, or do you use the statement? Is it part of your mantra, your daily regime, to question yourself by saying, did you get your daily dose of fiber for today? If this is a common issue that you dwell over, if you are concerned with as you lay out your diet for the day, it's going to be my guess that it's more than likely that you are consuming way too much fiber. Because if you're trying to plan for it, in your daily intake of fiber, more than likely you are superseding the safe levels of fiber. What have you, and if do you, by the way, construct your diet based on if you had a bowel movement that day? If you feel that having that bowel movement and not having the bowel movement is going to urge you to consume tremendously larger amounts of fiber to rescue your colon, I'm going to tell you that you more than likely have identified yourself as an individual who is taking way too much fiber, which is leading to the very problem that you think is corrected by further consumption of the fiber. I hope I'm clear about trying to expose whether you do have a fiber issue, not whether or not your health can be inappropriately affected in a detrimental way by the consumption of the fiber. I'm looking here in front of me right now with a whole host of fiber recommendations. These are recommendations from Food and Nutritional Board of a division of, and here they come. Boy, I see this name. It gets my juices going, folks. I've talked about them incessantly over the last few weeks. This is these are the recommendations from the Food and Nutrition Board, a division of, here they come, the Institute of Medicine of the National Academies. I didn't even know about that last part. I know about the Institute of Medicine. These folks are, well, let me get into it. They have recommended, their nutrition board has recommended and established the nutritional policy and guidelines of the U.S. government. Let's analyze the recommendations. Here they come. They have said that from children from 1 to 8, that the amount of fiber that is required, unfortunately, isn't based on the actual need, but the fact that up to 25% of children in this age group suffer from constipation. And they suffer from constipation related to a number of things. Number one, the abuse of antibiotics, certainly wiping out the bacterial flora, lack of breastfeeding, poor toilet training, inadequate nutrition, frequent diarrhea, and other factors. In this case, fiber is used as a hard laxative. That's why the recommendation is as high as it is, because they say the large intestines of a 1-year-old, which is about 1/10 the size of a fully grown adult's, but the recommended dose is only half of an adult. They say, the Institute of Medicine, this wonderful group, has said that the consumption of fiber in that age group of children, 1 to 8 years old, should be between 19 to 30 grams of fiber. And I'm going to tell you, folks, that is way too much fiber. With that much fiber in the diet, the child will be irritable from abdominal pain, bloated from large volume of stools, flatulent from gases due to fermentation, prickly with good food because eating causes cramps, and prone to frequent bouts of diarrhea. This is the syndrome we start to set up if we actually even attempt to follow the guidelines set aside for the ingestion of fiber by the Institute of Medicine, coming to you straight from your U.S. government. How about teenagers and adults? The recommendations from this prestigious institution of medicine for teenagers and adults, similar to the amounts of fiber are recommended for teenagers and adults, similar amounts. So there's no distinction between teenagers and adults when it comes to the daily intake of fiber recommended, because they say somewhere between 26 and 38 grams of fiber is the bare minimum amount. But if you consume that much fiber, it means large stools, inevitable anorectal damage, and eventual dependence on fiber to move the bowel. Way too much fiber. How about your own diet? How do they stack up with the amount of fiber you take? In the elderly, the recommendation for the elderly, people get older, less fiber is recommended, not more, as many do think, because the digestive organs are no longer agile and healthy. Unfortunately, this is not what most constipated elderly patients hear from their medical doctors. The majority urge seniors, hey, increase your fiber consumption in order to relieve the constipation. Even so, 20 to 30 grams of fiber for people over 50, half of whom already suffer from hemorrhoidal disease and from diverticular disease by the age of 60, is a prescription for trouble. These are the recommendations that came to the medical profession by an institute of medicine, and it is quite common to hear doctors urge for the increased consumption of fiber as a health-sparing measure, when in fact it is absolutely harmful to your health, especially at those doses. So by opening up this discussion, trying to set the stage for Monday, where we said minor quantities of fiber from natural unprocessed foods are completely healthy. There's nothing wrong with it. But this thing of the recommendations points out how far askew from small amounts can be if you follow those guidelines, and they are followed. And that's why it's quite common to hear from your doctors in any moment, anytime bowel dysfunction occurs, you're encouraged to increase your fiber content, which is probably already too high to begin with, perpetuating the problem, creating a vicious cycle. Now, there are even enhanced recommendations coming from such a prestigious institution as the Mayo Clinic. I now cite what the Mayo Clinic is recommending to their patients based on a 2004 issue of the Mayo Clinic Women's Health Source. Suggests ways to increase fiber in your diet. These are little bitties passed on to patients that they treat, encouraging you to more than likely increase your fiber way higher than it already is. They say that the Mayo Clinic, eat a high-fiber cereal or add a few spoonfuls of unprocessed wheat bran to your cereal. That'll spice it up. That'll get that fiber level up 2 levels. That's way higher than you actually should ever approach. Another recommendation from the Mayo: add bran cereal or unprocessed bran when making foods such as meatloaf, breads, muffins, cakes, cookies. Why? Because the bran cereal has a high fiber content. Choose whole grain breads, which we would say, hey, how healthy is that? Instead of white bread. I think we do encourage that. But we do so by bringing you concentrations of fiber that take you out of the realm of this small quantity that could be healthy, but I believe you move into another realm when you start choosing these whole grains, which I think the alternative world, doctors like myself, have always done so. Look for breads made with 100% whole wheat flour, another way to boost up your fiber content. Here's another recommendation from the Mayo. Substitute whole wheat flour for half of all the white flour when making. As a little ditty, experiment with whole grains and whole grain products such as brown rice, barley, whole wheat pasta, bulgur. These are all used to try to increase your level of fiber to help you with your function of elimination, and if they actually assist you in reaching elimination Valhalla, point to the fact that you're well entrapped and entrenched in this cycle of harmful levels of fiber, if that's in fact what you need to correct what you believe to be bowel and elimination issues. Try adding canned kidney beans, garbanzos, and other beans to canned soups and salads. A very understandable and really I've heard the recommendation frequently by medical professionals. Eat snacks that are high in fiber, such as fresh and dried fruits, raw vegetables, low-fat popcorn, and whole grain crackers. Add barley to soups and stews. Eat generous quantities of vegetables and fruit. Now, if you follow this advice, just 1 cup of Kellogg's All Bran has with extra fiber gives you 30 grams of fiber. If you start your day off with all brand, you're already at 30 grams, a dose that was inappropriately too high for you to begin with, but you've started your day with it. Already the daily amount recommended for adults is more times and much more times higher than that for a kid. If a kid's eating a cup of Kellogg's all-brand cereal, I don't see that as high on their list. They're like sugar-coated things, and by the way, you probably could purchase it that way. And that's just for breakfast before adding the recommended bread, salad, soup, stews, and generous quantities of vegetables and fruits throughout the rest of the day. Think about it. This 1 cup of fiber-fortified cereal contains 3 times more fiber than the maximum recommended daily dose of fiber laxatives that you're put on by your doctor, sometimes called stool softeners. Sounds like a wonderful word to use. Metamucil was a very good representative of that group. 3 to 4 grams up to 3 times daily is what you'll get if you take the Metamucil as has been prescribed. Even a little, just under 12 grams of fiber in Metamucil may cause severe side effects, and they list them right on the label. The side effects of taking Metamucil. Now that, and 3 to 4 grams up to 3 times a day, so that's 12 grams of your 30 can produce, here are the side effects written on the label: bloating, gas, and feeling of fullness may occur. If these effects continue or become bothersome, inform your doctor, so the label says. Notify your doctor if you experience stomach cramps, nausea, vomiting, rectal bleeding, unrelieved constipation. These are the recommendations that are provided for anybody who has a high fiber content diet. This is spelling out the problem, folks. Do you take minor quantities of natural unprocessed fiber in your daily diet? Or are you superseding this minor quality level? We're going to be able to establish from the professor Monastersky what maybe, because I can't see anywhere, at least this part of the book, what the actual values of that would be consistent with small amounts. But we'll be mentioning them as we continue with the professor here on Monday. I hope you look forward to it. Yes, we have a new mantra. Yes, there he goes again. Fiber can be hazardous to your health. Anything outside of this small quantity ultimately leads to the potential, at least, for great harm. I quote you a source from a book, a medical textbook entitled The Functional Gastrointestinal Disorders. It comes out of chapter 7 in that book, entitled Constipation. Many patients, this one little sentence is mentioned, many patients starting out fiber complain of flatulence, distension, and bloating, poor taste, and are unwilling to continue. This is out of a medical textbook talking about how you deal with constipation, and when prescribed, what I believe the doctor will end up prescribing for you, which is, hey, increase your fiber intake, take Metamucil, take other stool softeners, use psyllium husks, you do whatever. These are all examples of fiber. Ultimately, to have a comment in a medical book say, many patients starting out from those recommendations of taking the fiber complain of flatulence, distension, bloating, and poor taste, which should be neon signs flashing that this is not correct, that this would maybe be an inappropriate recommendation. What I'm gathering from the book is the closing statement, and are unwilling to continue, means that they have a problem. They're going to be recommending a substance that provokes symptoms that they unfortunately know will impede their recommendations being followed, is the way I grabbed this out of chapter 7 in a book entitled Constipation. And we'll put this issue for now to rest about the fiber. We'll pick it up on Monday with Professor Constantine Monastersky. Interesting guy. I will say that for those of you who can remember the show, we tried to do it, and we really did try. We tried to have Dr. Michael Kiriak on our show, a Soviet scientist, the developer of that F3 product line, the bioengineered algae concentrate, you know. And the gentleman, his English was pretty poor. We had a tough time communicating that day. We are going to bring him back, and I promise that when I bring him back, I'm going to submit questions ahead of time that are going to allow him to respond in English rather than him trying to respond off the cuff from my questions. Because quite honestly, as I spoke to him, it was apparent that he didn't understand the question, and he gave an answer that really wasn't appropriate. So with that in mind, I'm going to tell you that the gentleman that we're going to have on Monday and Wednesday, although you'll absolutely detect a Russian accent to it, this gentleman's command of the English language is impeccable. He came out with words when I spoke to him on the phone. I didn't know what he was talking about, and they were scientifically correct. Not because he said it incorrectly, but because I never heard the word before. The guy's command of the language is going to be something you won't have to cut through. You'll be able to understand quite clearly, and the message he has is extremely important. I'll say that in preparation for this, if you'd like to be able to go to his website, I'll give you the website. It's GutSense, G-U-T-S-E-N-S-E, GutSense.com. And you can read about Konstantin Monastersky as your homework assignment for our Monday show. You don't want to miss it because fiber can be hazardous to your health. So long. Have a great weekend. See you then. Bye now.
AM Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, 724-942-3002. That's 724-942-3000. For Dennis J. Courtney, M.D.